male hair loss patients. I'm Dr. Ana García Melero, the scientific coordinator of Regeneractiva, and I will be your guide today. But before we start, I would like to go over a few details so you know how to participate in today's event. All the microphones will be muted, so there are no sound problems. However, you will have the opportunity to submit this question to the speakers by typing into the question box. You might send your questions at any time. We will collect and address them at the end of the presentation. Moreover, the session will be recorded, and we could share it under request. But first, let me explain you a little bit about us. Regeneractiva seeks a positive impact on human health, improving the quality of patients' life through regenerative medicine. We are pleased to present you AMT, autologous micrografting technology. It's a simple and effective protocol with enormous healing potential that is revolutionizing healthcare. Regeneractiva has many advantages, such as in a single season, the patient is the donor and the recipient of the autologous micrograft. We don't use any chemicals, and we use homologous tissue, which will active specific pathways to enhance self-regenerations. Another great advantage is that the whole procedure lasts less than 30 minutes. Furthermore, we have treated more than 50,000 patients worldwide today. And the technology is based on more than 20 specific scientific studies that covers 5 medical branches. So today, Regeneractiva is going to focus on male pattern hair loss treatment with the expert, Dr. Antonella Tosti and Dr. Colombina Vincenzi. Dr. Tosti is Frederick Brand Endowed Professor of Dermatology and Cutaneous Surgery at the University of Miami. She trained in dermatology in Bologna, Italy, which is the oldest university in the world, and was full professor in dermatology before moving to Miami in 2010. Dr. Tosti is internationally recognized as an expert on hair and nail disorders. She started a clinic dedicated to hair disorders at the University of Bologna in 1982. The very first clinic in hair world, as there were very few people interested in hair at that time. She is regularly invited worldwide as a speaker or sessions director at the EADV Annual Congress of Dermatology. She organized several meetings on diagnosis and treatment of hair and nail disorders in Italy, including a very successful annual course on hair, nail, and cosmetics in Capri. She is also member of the International Academy of Trichoscopy. And moreover, she is author of more than 600 peer-reviewed papers and co-editor of 30 books, including 10 published books on diagnosis and treatment of hair disorders. Furthermore, she is editor-in-chief of Skin Appendage Disorders. And finally, Dr. Tosti trained hundreds of dermatologists from all around the world. And she is proud to say that many of them are recognized as an expert in hair and nail disorders. On the other hand, Dr. Colombina Vincenzi graduated as MD in 1988 at the School of Medicine at the University of Bologna. In 1991, she obtained the diploma in the specialization, and in 1993, the PhD degree. Both at the Department of Dermatology in the University of Bologna. She has been involved, along with Dr. Antonella Tosti, in hair and nail disorders clinic so far, and she is also co-author of numerous peer-reviewed papers on hair and nail disorders disease, including clinical studies on new advanced treatments. She was co-author of one of the first published papers in the utility of hair dermatoscopy later called trichoscopy, published in one of the most important international dermatological journals. So we have divided our webinar into three main parts. First, our keynote speaker, Dr. Antonella Tosti, will give us an overview of the current male hair treatments. Then, Dr. Colombina Vincenzi will share with us her great experience with AMT, as she will show us the protocol and the results of a study that she and Dr. Tosti have performed with our technology. And finally, we will have some time for question and answer. So I hope you enjoy and learn a lot. So let's move to the first speaker. I will hand you over Dr. Antonella Tosti.
Hello, Anna. I cannot start my video. It says you have to allow me, okay?
Yes.
Okay. So, okay, I did. So, good morning to everybody. And hello, Anna. Thank you for the introduction. And so I'm going to share my screen and start my presentation on the treatment and the diagnosis of male pattern hair loss. And so do you see my screen?
Yes, we can see it, but it's not like...
I'm going to, perfect, I saw that. Okay, good. So
Perfect.
Let's discuss what we have and how we should use to have the best possible results. So we have very few approved treatments, and I would say 2 all over the world and 1 that is only approved in a few countries. And some of these treatments may be very effective. You see, for instance, this patient, he improved a lot after treatment with oral finasteride. But usually patients are not happy with the treatment we have. Why? Because they don't want a treatment. What they look for is a cure. And sometimes it's very difficult to discuss this with the patient. And so, while patients also don't like the approved medication, because again, they don't want to have to do something for their life. This is one of the most common answer that the patients tell me. That I don't want something that I have to do for all my life. I become a slave of the treatment. And of course, they are afraid of possible side effects. So the purpose of my presentation today is to explain how to have a good results and a satisfied patients, because these two things don't always go together. Sometimes you have good results, but the patient is still unsatisfied. So first thing is targeting. So you have to target the treatment to the patient that you have in front of you. So you have to take the time to discuss and to understand what he wants and to explain the treatment that you can offer. Try to associate. My treatment is never one treatment. I do everything I can do to improve that patient. And we need to always to have options for patients who don't want medications, because nowadays it's common to have patients that don't want medications, or they want natural treatments, and you have always to try to manage their expectations. So we have a number of possible options I'm going to discuss with you today that include topical treatment, mesotherapy, oral treatments, light, and procedures. And let's see, and of course, hair transplantation. And when to offer one or the other, that's the clue. So before starting discussing the treatment, I want to be sure that you make the right diagnosis. And the most important disease that should not be overlooked is this fibrosing alopecia with a pattern distribution that is becoming more and more common. I see many patients with this disorder, and they may easily be misdiagnosed as androgenetic alopecia. So what you have to do, you have to look at the scalp with your dermatoscope, use dry dermoscopy, and look at the scalp of all the patients who look like have androgenetic alopecia. And sometimes you see these features that should be that are suspicious, and you see these peripilar casts surrounding tufts of hair. These are the sign that indicates that this is not just androgenetic alopecia. Of course, there is variability, but there is something else. There is inflammation. And so this is fibrosing alopecia with a pattern distribution. I wrote a review this year on the JAD together with Dr. Trub, who is the one who first described this condition about 10 years ago. And it's very important not to be missed, because this is, as I said, common and of course requires a different treatment. So fibrosing alopecia and pattern distribution was first described in the 2000 and is a scarring alopecia sharing characteristics of both androgenetic alopecia and lichen planopilaris. And as I was saying, is more and more common. So these patients look like androgenetic alopecia. Sometimes they complain of scalp itching, and scalp itching can be a clue to these to suspect this condition. And the severity is variable. Again, this is a patient with if we look at his dermoscopy, with a lot of scarring, but can look like an androgenetic alopecia, like a severe androgenetic alopecia. And these patients go around for hair transplantation. This patient came to see me because a transplant doctor told him that he couldn't have a transplant because he had a variant of lichen planopilaris. So the transplant doctor made the right diagnosis, but the patients didn't believe it. And so they keep going around. And that's why you should be very careful not to miss these patients. And trichoscopy is very typical. You have hair shaft variability and a peripilar cast. And of course, if you take a biopsy, you see the miniaturization and also the lichenoid inflammation at pathology. Second, so the diagnosis, you have to be careful. Of course, this is an easy diagnosis, but sometimes you may be misdiagnosed with something else. So, second step, assess severity and patient's preferences. So you need to discuss the options in advance. So patients often have wrong expectations. I would say all patients have wrong expectations, and they want to see the results immediately. So it's very important to set down these expectations at the beginning. And this is a movie I'm going to show.
Hello, welcome back. How are you doing?
This is my son
Well,
that
obviously.
acted as an actor.
Since the last 6 months, since last time I saw you, my hair situation has not improved. If anything, it seems to have worsened. And I'm very concerned. The therapy that you have prescribed to me is not working out for me.
Okay, let's take a look. So you were supposed to use topical minoxidil, 5% topical minoxidil twice a day, and the Propecia pill. Did you do the treatment regularly?
I honestly, it seems very invasive. I do not have time to do it twice a day. I work very long hours, and I honestly forget to do it. And I don't know. I've been doing it as much as I can, but still see no improvement.
Roughly in 1 week, how many times did you apply?
Maybe 2-3 times a week.
Only 2. And what about the pill?
The pill I take whenever I remember. I don't have a tight schedule for it, but it seems. But I do take it. I take it as much as I can, but see it still no improvements. I don't understand why.
Hello.
So this is something that happens. How many patients are like that? Many patients. And so what should we do in this case? Should we insist on the prescribed treatment? I don't think this patient is ever going to do the treatment in the right way. So here is a patient where I would offer a procedure, because it's a patient who is not using a topical treatment, who is not even using an oral treatment, forgets to take a pill. So these patients cannot be treated on a daily basis. They need to come to see you and have something done. Then you have to look at the severity. And here you see a patient with mild disease. And I discuss with this patient what he could do. And he say that he cannot commit to a topical treatment. You know, young patients often don't want to commit to something they have to use on the scalp. He already utilized finasteride without good results. And he doesn't want oral minoxidil because he has a very low blood pressure. So again, you don't have any options here. You can utilize procedure, and so you can utilize PRP, you can utilize Regenera, and you can maybe utilize the low-level laser therapy, even if sometimes you have to be careful, because if the young patients don't live by themselves, but for instance stay in the college, they will never use the low level light therapy because they feel their friends will take joke of them. So we did the light, and we did the Regenera with him, and he was very happy, because sometimes maintaining maybe the most important part, and he improved in reality. Here we have a patient with a moderate disease, and he said that he prefers a topical treatment. This patient is very afraid of possible side effects of medication, but cannot commit to a daily treatment. So he wants a topical that can use once in a while. So here you see the options I discuss with him, and then we decide to utilize this finasteride, which is a gel that is a liposomal formulation, so she can be used 3 times a week. And here you have another patient with a kind of moderate disease. And I spoke with him, and he prefers an oral treatment, and he's not afraid of medication. So here I propose all the options: dutasteride, oral minoxidil, and also procedure like PRP, Regenera, and mesotherapy. And so we did the dutasteride to start with. He wanted to just to start with one thing, and you see that he improved a lot in 6 months. At this point, I will definitely add something else in order to obtain the optimal results. And what about these patients? These patients, you really have to explain that with that, medical treatment, probably you will never be really happy. And so maybe this is one that may be a good candidate for surgery. So topical minoxidil, what patients to choose? You have really to ask about commitment, okay? So this is not often a good option in students or people with business that require long working hours. A student that has to wake up at 7 to be at school at 8 o'clock probably won't ever use the topical minoxidil. And instead, it's a very good option in patients who shave, which are many men now shave, because in those patients, it's very fast to apply the solution. And it's very important to stress that they have to use twice a day, because otherwise they don't use twice a day, which is an issue. Oral dutasteride, finasteride. You need to discuss from the beginning the problem of possible sexual side effects and depression. And in young patients who have a history of disorders that may affect fertility, which are common in men, I order a baseline spermiogram now. And don't prescribe finasteride, dutasteride in patients who have history of depression. And here is a list of the symptoms of the post-finasteride syndrome that they are going to find immediately after they leave your office if they Google, okay? And you see that these symptoms are are numerous and various, and includes melasma, very strange things. So it's quite easy for a patient to develop one of these possible symptoms. And but there are also, symptoms of depression that are important. So I personally don't believe in the post-finasteride syndrome, but it's something that you have to discuss with your patients, because otherwise they won't be happy. And why they have these sexual side effects, you probably know. The problem is that the testosterone increase during treatment with alpha reductase inhibitor, and it may be metabolized to estradiol through the aromatase pathway. So probably depends on the availability of this pathway, which patients develop the side effects. And, and 5-alpha reductase is a very important enzyme in the brain, and that's probably why they also have depression as a possible side effect. There is a recently published review, and they discuss the post-finasteride syndrome, and they find evidence that link the medication with depression. When dutasteride, dutasteride is a very good option in patients who have also seborrhea or excessive body hair. And I try to avoid dutasteride in young patients, because I don't think the data we have on fertility are enough to guarantee that it doesn't interfere. And it's a very good option in patients who had not responded to finasteride. Here you see an example of a man who did not respond, improve a little bit after 1 year of finasteride, but you see how much improvement had after 6 months of dutasteride. Topical finasteride. So topical finasteride, you really need to discuss risk of contamination. So don't prescribe if wife is pregnant or willing to be pregnant. And I like the liposomal formulation because it doesn't not require daily application. And I know these topical finish phase 3 clinical trials, and you see in this graph that perform very well. This is a comparison with the oral and the topical, so it's definitely effective. And this vehicle is characteristic that allow a poor scarce penetration as compared with the normal vehicle. I like to use intralesional minoxidil dutasteroids, but you have to be careful on what you use. Keep in mind that mesotherapy is not approved in some countries, such as in the United States, for instance, and I don't use a single treatment. I always associate. But I'm aware of a case, a recent case of silicone granulomas due to mesotherapy. Here you see a case of mine improved with dutasteride and in mesotherapy. Yes, this is what I was saying. So these people utilized a solution that was on the market for microneedling. And so in this solution for microneedling, there is silicone, because it helps to keep the products on the top on the scalp. Instead, they utilize this solution as mesotherapy, and the patient developed terrible silicone granuloma. So be careful what you buy. And you can use also minoxidil intralesional. I like that. This is a possible cocktail that you can use. Oral minoxidil. If you want to prescribe oral minoxidil, and I prescribe a lot of oral minoxidil nowadays, it's very important to check your patients about cardiovascular disorders. So it's something that we as dermatologists always don't ask in deeply. Instead, here you have to be sure the patient don't have any problem. And this is a very good option for young patients. Of course, you avoid in men with excessive body hair, otherwise they will get worse and will complain. And absolutely avoid in case of tachycardia, rhythm disturbances, or cardiovascular events. I don't think you have to avoid in case of hypotension. In reality, it doesn't really lower the blood pressure. And this is a review I just published on the JAD on oral minoxidil about its efficacy and safety. So first of all, how you prescribe. What I prefer is just if you have the brand, just to cut the 2.5 milligram dose. That's the best, the safest way to do if it's available in your country. Otherwise, you need to compound. But you have to be careful because the dose we prescribe are very low and the pharmacists sometimes don't understand and make mistakes. So I had the experience of serious mistakes. And so I now use only one pharmacy because I know they do a lot and I know about the product. This was the mistake I was happened to me. This is a patient of mine. After 2 months, he emailed me saying, "Oh, I'm growing. The hair is getting better, but I'm growing hair everywhere." After 2 months, so it was very strange. And so I checked the prescription, and the pharmacist gave him 10 milligram instead than 1 milligram. So if you know, if it's maybe a patient with some cardiac problem, he can die. So you have to be very careful. So I like to use oral minoxidil in men. I usually utilize 1.25 milligram a day to start, but some authors use 5 milligram. And hypertrichosis for most men is not a big issue. This is a study that was recently published in Thailand on 30 men, again with 5 milligram, and they had an increase in the hair count, and the photographic evaluation revealed 100% improvement in all cases. And here you see the pictures, the vertex more than the front. So they had the hypertrichosis in most patients and edema. With 5 milligram, you have hypertrichosis. Low dose, very low dose is not very effective. This is a paper from Brazil. They use 0.25 milligram and they saw clinical improvement, but in reality, the Tricolab measures didn't show any improvement. So which are the side effects of low dose? You know, hypertrichosis, urticaria, sometimes they have ankle edema, sometimes they have tachycardia and increased hair shedding in the beginning. You know, it's very typical to see hypertrichosis on the dorsum of the hands. This is quite common, and usually they don't discontinue for this side effect. And you see here from the study published in the literature, systemic side effects were very minimal, and there are no reports of severe cardiopulmonary events. But you have to be careful. Don't prescribe in patients with cardiac diseases. And you know, you can use these watches to monitor the cardiovascular problems. You know, these watches now, they measure the pulse, the blood pressure, everything. They do the electrocardiogram, so the patient feels safer, and they are very cheap. What about the low-level laser therapy? This is a treatment that is a very good option for only natural patients. So patients who don't want medications, that's an option. I usually add the low-level laser therapy. I don't use that as a single treatment, but I associate with procedures, and I think it's a very good option in case of scalp inflammation. And I see patients from a very large geographic area, so I don't have the instrument in my office. I have them buy the instrument at home. And you see, if you see scalp inflammation at dermoscopy, this is a very good patient, a very good candidate for the low level laser therapy. And the contraindications, of course, mainly scalp malignancies or photosensitive disease. PRP, again, I don't utilize as the only treatment. I associate to other treatment. And again, here you have to settle the expectations, because sometimes they believe that with the PRP, they will regrow hair like after a transplant, and that's the problem with this procedure. You have to explain the patient what they can see. And the same for the microneedling, I utilize in combination with topical minoxidil or with PRP. And, here, for instance, you see this patient, he came to see me because he wanted to grow hair here. This is no way he's going to respond. He's going to obtain what he wants with any medical treatment or any procedure. This is a perfect candidate for hair transplantation, and he was very happy with that. So also for Regenera, it's very important to select the right patients. So Regenera is not a substitute for transplantation. So it's not an option for the patient that I just show you. And again, I like to associate with other treatments. So the patient has to have the right expectations. Otherwise, cannot be happy. And here you see some very good candidates. They have a mild androgenetic alopecia. These will definitely have benefit. But here you see wrong candidates. This is too severe to have a real good benefit. And this is somebody who already had a transplant, and they want a stem cell therapy because the media give them wrong information about what they can have. So it's very important for us to give the right information. And now I'm going to give you this take-home message. So treatment should always be personalized. So you don't have to just use the medication. You have to personalize the treatment. So you have to discuss and understand what your patients want first. This is the most important thing. And then select the options that are suitable for his needs and severity, and offer a complete plan that includes medication and procedures. And you have to follow up with pictures and trichoscopy. It's very important because sometimes patients improve a lot and they don't even notice that. And if you don't have pictures, this is going to be a problem for you. And now I have Dr. Vincenzi, who is going to show you the results of the study that we are doing with Regenera in Bologna. This is a study, so all these patients she's going to show you just had the Regenera treatment. So Dr. Vincenzi, please.
Yes. Are you hearing me? No?
Yes, yes, yes.
Okay. I'm trying to share the video, but maybe it's not allowed to share. Anna? Okay.
Can you, Colombina?
Yes.
Okay. You are the host now.
I'm the host.
Yeah. You should share your computer.
Sorry,
No worries.
I'm not able to share.
I will come and help you.
Thank you. No, no, stai qui.
Vedi che non mi prendo il Covid. Togliti.
Cosa stai facendo?
Ah, io ho fatto condividere lo schermo e viene fuori quella. Ah, ecco. No, quella è la scrivania.
Amore, per fare il TV, non è questa la presentazione?
Sì.
Ecco.
Now you have it. Yeah.
Ok. Thank you, Antonella. Yes, okay. Now I would like to share with you our experience with Regenera and show you briefly how it works and how to do it. Here you can see that the device that is used to obtain the micrograftling. And the goal is to reach micrografting from the scalp, very rich of progenitor cells and growth factor, and to donate these micrograft to the same patients where you have to perform the biopsy. So this is the device. Every device is has a grid, and every grid contains 100 holes, and every holes has it's 6 grids designed to cut the scalp that you will relieve from the occipital area of the patients. Why the occipital areas? Because this is very much vascularized, and is an area that is not influenced by the negative influence of the androgens that they cause miniaturization. And also from an aesthetical point of view, you will not have any issue because it is retroauricular. So I'll show you the device is this. Is a single-use device. It is very important. Is of only for one patient. And so this is the procedure. You have to shave the area in the retroauricular regions, do the anesthesia without vasoconstriction, no adrenaline, and then you will obtain 3 punch 2.5 millimeter punch biopsy, very small, and you don't need to do any suture. And so from an aesthetical point of view, and the patients will not have any problem for the medication after the treatment, after the session. So you will put the biopsy in the device, and then put in the machine that will obtain the micrographs, cut the skin biopsy. Then you put in the device 1.2 milliliter of physiological solution, and retrieve this liquid that contain in this point the micrografts rich in progenitor cells, and put another 1.2 milliliter in the device to clean the device and obtain most of the graft you can. and then dilute this solution and are ready to injection. The injection have to be very deep, 4 millimeter, and one you have to put 0.1 milliliter for every point. It's not very painful for the patient. Now I'll show you the results of our study, and we enrolled 17 patients, 10 males and 7 females affected by mild androgenetic alopecia. The study was done in Bologna, in Italy, and we evaluated the patients at the baseline after 3 and 6 months, and when possible also after 1 year after the treatment. These are the inclusion criteria from 18 to 65 years with the mild diagnosis of androgenetic alopecia. And we asked to all the voluntary to maintain hair length, color, and style for all the duration of the study, and above all, not to accept not to start any other treatment for hair loss until the end of the study to verify the efficacy of the regenerate treatment alone, not influenced by other treatment. These are the exclusion criteria. We excluded patients with scarring alopecia, alopecia areata, inflammatory scalp disorders, or with systemic disorders. The females, of course, not pregnant or breastfeeding, or with history of hair transplant or scalp tumors. And we excluded also patients that were in medical or with other treatment for androgenetic alopecia within 6 months prior to study entry. So how we evaluated the efficacy clinically using the global photography together with the video dermoscopy, and also we did the Tricolab evaluation. We administered to the patients also a questionnaire to investigate their satisfaction about the treatment. And we used the 7-point scale to evaluate hair density by global photography. And instead, the Tricolab evaluation, I don't know if everybody knows it, but calculates hair density and thickness using dermoscopy images without the need of hair shaving. And through Tricolab, you can have the following parameters, but the most important are, of course, the average number of hairs and the average hair shaft thickness, the hair diameter. And these are the results of evaluation of the global photography. We have 5 subjects stable without no change, no improved, no decreased, and only 1 subject slightly decreased the hair density, and instead 5 subjects had a slight increase and 6 a moderately increased of the hair density. This is the global photography. This is the questionnaire we administered to the subjects, and when we evaluated it and asked to the patients if they were happy of the treatment, most of them answered yes. and they feel less hair loss, yes, and most important and is that they tolerated very well the treatment without pain, without any problem after, from an aesthetical also point of view. These are some examples of our results. This is a woman of 64 years old, and you will see a very good result at after 3 months and after also 1 year. And these is the air frontal region and the parietal region. You will see the improvement. This is a boy, 18 years old, and also he was very, very happy of the treatment that was maintained after 1 year later. And this is another example, a 26-year-old boy with a mild androgenetic alopecia, and he was very happy of the results, and you can see the global. This is another patient that obtained very good results after 3 months, but but decreased maybe such a little after 6 months of treatment. And you can see the frontal, the parietal region. This is a very another happy boy, very happy of the results, you can see. And these are the results of the Tricolab and evaluation. You can see that after 3 years at the first follow-up in the frontal region, there was a 7.35% of change in the air thickness, so the air diameter increases, and after 6 months there was always a change in an increase in air diameter, but just a little less. So in the vertex there is again an increase of the air diameter, but the data are not statistically significant, like such as in the frontal part, and the same after 6 months. So the conclusion, as considering the global and the Tricolab evaluation, we can say that there is no effect on number of hair as expected, but there was a significant increase in diameter in the frontal area and also in the vertex, but not statistically significant. Thank you. I finished my presentation.
Rina, stop the screen sharing on the top. You have to remove the screen sharing.
Yes.
I want to now just to show you a very short video of a testimonial of a patient who was very, very happy with the Regenera treatment. Anna, can you please allow the screen sharing to me? Here it is. And
Yes.
I'm ready. And so this is a video. Oh, good morning. How are you?
Good morning, Professor. I'm very well, thank you.
Thank you very much for accepting to participate in this interview about your experience with Regenera. So can you tell me a little bit about your experience?
Sure. I would say that overall, the pain level, which you experience at the beginning when you actually have the procedure is quite mild. It's nothing too complicated or difficult to handle. So I was very happy about that. After that, at least for me, my experience was the first few months, I didn't see much of a change. I'm talking about probably three months in. And at the 6-month mark, you actually start seeing your actual hair becoming thicker. And this obviously is followed by, if you obviously look quite closely, some little, let's say, new hair which starts growing. You can notice that on your scalp. And so, yeah, I would say that's when you start really seeing a result.
When did you have the treatment?
I had the treatment mid-September 2019.
Also, it's 1 year. Okay.
Exactly.
Are you doing any other therapy in addition to
I'm not following any other therapy because a few years back started a minoxidil therapy, but I turned out allergic to that. So after that, this was obviously offered by you, and I had good results. Yeah.
Okay, very good. So if you have to tell something to a patient like you, what would you say?
I would say don't be scared of needles at the beginning, because obviously when doctors will prepare you saying there's a lot of needles involved at the beginning, but that's nothing to worry about. And second, don't panic at the beginning when you don't see any visible results, because they will come.
Okay.
Definitely.
So thank you very, very much.
Thank you very much, Professor.
Bye-bye, take care. So this video shows very well how patients can be very, very satisfied. Okay. So let's open to questions. We have some hands. Can you allow to talk? So I'm allowing the people who raise their hand to talk. You have to unmute yourself. So the question is, what anesthesia do you use during Regenera? Dr. Vincenzi, can you answer the question?
Yes, lidocaine usually without epinephrine, because you need to have vascularization. So it's better to use pure lidocaine.
Okay. No other questions? Can I use minoxidil? Yes, of course, because Dr. Vincenzi was showing our study. So we did the study without any other treatment, because the reason was to see the efficacy of only Regenera. But that's nothing that you do in your real life. In your real life, you should utilize everything together. And here there is a question that for me is important. How frequent should be done? I believe they suggest once a year, but I believe once every 6 months is probably the best from the results I saw in my patients. Because in 6 months, they see the best results. And then the results, if you don't do another treatment and they don't have any other therapy, start to go down. So I believe every 6 months is probably the best schedule. So.
Okay, Antonella, if you want, I can.
The recipient side, no. You can use vibration, but you don't need anesthesia in the recipient side. Yes, Anna?
If you want, I can read the questions and you can answer. Maybe it will be easier.
Okay, of course.
Okay. Okay, one question is, can Regenera be used to treat alopecia areata?
I don't think so, because it's the rationale is not there. No, I wouldn't suggest.
Perfect. We are, on behalf of the company, we also don't suggest to do that because we are optimized for androgenetic alopecia. Okay.
I see this question can be combined with other, yes, can be combined, you know. And can we use Regenera for frontal fibrosing alopecia? You know, I right now, I believe we have no data on procedure on frontal fibrosing alopecia. I personally don't even use PRP for frontal fibrosing alopecia. And we don't know the cause of the disease, but we think maybe somehow environmental, and I wouldn't recommend.
Okay, thank you. This is a question for Colombina. Please repeat the dip and the amount of injected each side.
4 millimeter.
And the amount is...
No, the dip of the injection, the dip.
4 millimeter.
Yeah, 4 milliliter. And the amount is 0.1, no?
0.1 for each point at 1
Exactly.
centimeter distance each other.
Perfect. Okay. Can oral minoxidil be prescribed to female patients in the same dose of 1 milligrams per day?
Oral minoxidil, I usually give more than 1 milligram per day to men. Okay, so in men, since the hypertrichosis it's not such a big issue, I usually give 1.25 or even 2.5. So I go higher.
Perfect, thank you. Munatha Nasir has asked if we can show us the procedure of Regenera. I think that Dr. Colombina Vicenzi has done perfectly, but if you have any more doubts, please just contact us and I can share you the whole protocol well described. Right?
We have a very nice video, but we don't have time today, but maybe next time, because we are going to schedule another webinar, we can tell them the date.
Okay, yeah, on 17th of November.
Okay.
Yeah.
Still, we don't know the time, but we know the day. And
Exactly.
maybe on that occasion, we can show you a video that it may be very useful.
Yeah, good idea.
This is a question about the period to expect the results. You know, you have to tell them that they won't see any result before 3-4 months. Okay, because that's the way you have an unhappy patient, because they go home and think that in 1 week they are going to see results. And our testimonial really show that. For the minoxidil, I usually start a little bit low. I start with 1.25 and then I increase if they have no side effects.
Okay, the hair shaft of hair follicles mixture in the solution doesn't have any strange body reaction at local of injections. It hasn't been reported any. Do you have any problem on this?
No, I didn't see any reaction in the injection site. Never with my patients.
Okay, and also there is a question that says, please repeat how Regenera works. If it's in terms of protocol, as Dr. Antonella Tosti suggests, we will share a video next time. And if it's a matter of the biological mechanism that it works, I don't know. Do you mind if I answer that? Okay. you just take some skin biopsies from the scalp, and because you get a micrograft solution with all the cells, growth factors, cytokines that there are from the donor part, you inject in the damaged part, and it allows to the activation a lot of biological pathways in order to enhance the regeneration of the area. So there is a high increase of the vascularity. There is migration, avoid the apoptosis, and all these effects will allow the hair follicle to grow bigger.
Yes, to regenerate.
Exactly. As Colomina has shown, as Dr. Vicente has shown, you can see that there is an increase of the thick of the hairs. It's really, really great news.
Yes.
You don't have more hair, you have a thicker hair.
Yes.
Okay, there is another question. How about older patients? Say like 60s, in good health, with diagnosed androgenetic alopecia and decent hair coverage. Due to decreased progenitors, will be necessary more than one procedure or more biopsy samples? What is your impression?
I think we had very few old patients, to be honest. Okay, most of our patients, but were young. But the lady that had those fantastic results, she was in her 60s. So, you know, we don't have enough data to answer, but probably you don't need more.
Okay. Another question, this is for Colomina Licenzi. What was the physiological solution at before putting the biopsy pieces in the Regenera machine?
Chloruro di sodio.
Sodium chloride.
Okay.
Yeah. The physiological serum, right?
Yes.
Yeah, Amanda has asked again that if the conclusion of the study is that there is no difference in hair count, only in thickness of the hair, and that's right. But
yes,
it's really nice to have these results also, no? Because it would be weird to have more hair count because you have the hair that you already have.
You know, the count usually in the studies increase in the beginning, but also all the new studies with medications, they show sometimes an increase in the hair count in the beginning, then the hair count decrease. That's because, you know, some follicles may be in telogen, so, and in the beginning.
Yes, empty. And
there is another question that it says, is PRP considered superior to Regeneractiva?
I don't think we have a comparative studies, but I think they may be complementary, you know, because Regenera you do once every 6 months, once a year. PRP, of course, you have to do more frequently. And my idea is to try to combine everything you can.
Thank you. And also the difference between Regenerativa and PRP is that Regenerativa has the advantage that you use homologous tissue, whereas when you are using PRP, because you are getting growth factors from the blood, you are not using the same homology tissue, and you are using like growth factors that could be really, really interesting to use in combination, as she says. But there is like a small pill, well, a pill with full of growth factors. There is not cells involved in that. Okay. Okay, how soon do you see the results after regenerative treatment? Because some doctor
After
claims
3
results
months,
visible.
you can see the first result. Yes,
As the testimonial has said so, no?
yes. As every hair treatment, do you need time, at least 3 or 4 months to see the results.
I have this question. Why can be used for moderate or severe? I think can be used for moderate. I think, for severe, I don't even use PRP. Severe disease, probably, to fulfill the expectation, they need a transplant, is possible. Because what the patients want when to come to see you is to have hair. So if it's very severe, you cannot just offer something that will not fit the expectations. That's very important.
Okay. Another question is, what is the maximum number of grafts that can be used in a single sitting for maximum coverage and optimal results?
I didn't understand this question. What is this question?
The maximum number of grafts, the number of biopsies that you take?
3. Usually 3 has been evaluated at the right number to reach the best number of micrografts.
Exactly.
You can use also 4 smaller, but than 2.5, 4 of 2 millimeter each, but 3, in my opinion, is the best.
And you can cover the whole head, right? With
Yes,
that.
yes.
Okay. Another question, Dr. Tosti, is there any proven treatment for graying hair?
For graying, not yet. But I'm sure it will be there because we see from side effects of medications that that's possible. So that we have only to find the pathway.
Okay.
I like this question. Has anyone tried Regenera for the bird? I don't know, but that would be very interesting to know.
Okay, in hair transplant, we get the donor from the occipital area, which is the most permanent hair, and the follicles are not affected by DHT. We can get some tissue from this area for Regenera instead of from the lower posterior hairline, as you suggest.
But it's the same area, in my opinion.
Yeah.
It's in the occipital area, the retroauricular region.
Yeah, I think that we are talking about the same region.
Yes, it's
another question. How many sessions are required in total?
we have to look. We now started with 1/6 session and we evaluated the results after 1 year. But maybe, as Dr. Tosi told before, we need to do another session before. That's 6 months.
We were lucky because this study happened in the middle of the COVID.
Yes.
Okay. So we were able to see back the patients after the lockdown. It was like a miracle.
Yes. But everybody came back.
Okay, here's another question. Does the hair count refer to follicle count? We know that Regenera will not increase follicle numbers, but I do note studies that refer to higher higher account per follicle?
I think that that's the hair count they do at Tricolab. It's done on long hair without shaving, and so it's they count the hair shaft.
Yes, I think so.
Okay. Another question is, can we use Regenera for skin diseases as vitiligo or even skin rejuvenation? Yes, we have another this also. Hubert said yes.
Thank you, Hubert.
Regarding the vitiligo and skin rejuvenation, yes, we have another protocols, and we are going to have some webinars on this regard. So please stay up, and you will see. Since the study shows that there is an increase on the diameter of the hair shaft, but there is not an increase of hair count, so how many sessions is maximum, or when is the end point? I think that when you
know, there are data that we still don't know.
Yeah.
We don't know that because even we did the protocol, but we don't know. Maybe if you repeat after 3 months, you have even better results. I don't know. The procedure is available in the US. It's FDA approved.
Yes.
I think regarding Regenera, I think we go through the main questions. I don't know if you have seen anything more that you can answer.
No, I think I answered all the questions I saw.
Yeah, perfect. Okay, so thank you very much for being here, for being involved with this monthly webinar with us. We are super happy of having you as part of the team in a sense that you are working with our technology, and see you in a month, everybody.
Bye-bye to everybody. Thank you for being with us. And
Bye-bye. Thank
Bye.
you. Bye.
Regenera – будущее регенеративной медицины. Лечение андрогенетической аллопеции с помощью метода Regenera. Выполняется разметка в гормононезависимой зоне с наибольшим количеством волос фолликулярной единицы. В зависимости от выраженности и распространения процесса на волосистой части головы производится забор от 1 до 4 биоптатов размером 2–2,5 мм. Далее выполняется местная анестезия раствором 2% лидокаина без добавления сосудосуживающих препаратов. Анестезия производится перпендикулярно и по периферии намеченной разметки. Производится забор биоматериала пациента с помощью панч-биопсии 2–2,5 мм в диаметре и глубиной 7 мм. За счет минимального размера после забора биоптата не требуется наложение швов. Благодаря оптимальной запатентованной системе, состоящей из 100 микропирамидальных отверстий и круглого ножа, производится данная дезагрегация ткани. После обработки к биоматериалу добавляется стерильный физиологический раствор. Полученный биоматериал помещается в запатентованную систему картридж Regenera Cons, где в течение всего 1 минуты будет произведена механическая дезагрегация тканей до размера 50 микрон. Картридж устанавливается в аппарат Regenera, где производится обработка биоптата. Процедура проводится в стерильных условиях. Полученная суспензия вводится в зоны, подверженные андрогенетической аллопеции, которые мы хотели бы регенерировать. Техника применяется по аналогии мезотерапии с созданием папул на расстоянии полсантиметра. Мы используем тонкую иглу 30G, что уменьшает болезненность процедуры. После лечения пациент может вернуться к своему обычному образу жизни. Голову можно помыть через 2 часа. В течение 24 часов не рекомендуется посещение саун, бассейна и физические нагрузки. Контроли после процедуры производятся через 1, 3 и 6 месяцев. Процедура выполняется амбулаторно всего за 1 час в размере 1 сессии. Процедура Regenera не требует повторений. Подробнее на сайте www.regenera.com.